Hello, my friends. This is Dr. Jeffrey Beto from chronicpainreliefoptions.com, and today I'm going to review for you a monograph which I recently published on chronicpainreliefoptions.com called How to Stop Shoulder Pain. This screencast will just do basic topic review, and for more in-depth analysis, please read the monograph on chronicpainreliefoptions.com. And so without any further ado, let's get into the monograph. The shoulder is a non-weight-bearing joint, and so it usually holds up quite well unless there's been repetitive trauma or direct trauma to it or some disease involving it. Other joints of the body that are weight-bearing have a tendency to wear out just from normal life activities, but the shoulder joint usually holds up throughout a lifetime quite well. It's important to remember that any acute shoulder pain should immediately be evaluated by a healthcare practitioner, because this usually means that there's other underlying disease going on. Acute shoulder pain that has no trauma involved with it may mean some serious malady in your chest. It could mean heart disease, and so you want that to be evaluated immediately. Chronic shoulder pain is defined as pain that lasts longer than 6 months in the shoulder. And of course, the key to effective relief is always a good and accurate diagnosis. And so that begins with a thorough history and physical by a qualified medical practitioner. And remember, this monograph is information only and does not represent medical advice. Treatment for your chronic shoulder pain should always be done by a qualified medical practitioner. Let's talk a little bit about the anatomy and physiology of the shoulder. The shoulder really has 3 joints. We're only going to talk about 2 of them because this joint here, the sternoclavicular joint, which is not really depicted even in this diagram very well, is really a joint that escapes most trauma. Most of your shoulder pain is going to be coming from these 2 joints here, and this is the glenohumeral joint. It's a ball and cup joint. It's a synovial joint, which means there's synovial cartilage on the ends of the bones here. And then there's the acromioclavicular joint. This is the joint that gets involved in shoulder separation. And this joint varies from person to person, whereas the glenohumeral is consistent from person to person. The acromioclavicular joint, or AC joint, may have synovial cartilage or may not. It may have a fibrocartilage disc between the bones, or it may not, and then they usually do have very heavy ligamentous banding here. Most of the range of motion of the shoulder comes from the glenohumeral joint, and it is a joint that has the largest range of motion of any joint in your body. The acromioclavicular joint and the sternoclavicular joint on either end of the clavicle really act like a tie rod for the front wheel of your car and kind of stabilize the shoulder. Now, along with the joints that we've already mentioned of the shoulder is a rich neural network called the brachial plexus. It's made up of nerves coming out of the spinal cord and the neck and the upper back that then conjoin and mix with each other and make up the nerves that go into the arm. Obviously, due to the proximity of the brachial plexus to the shoulder, shoulder injuries can result in nerve injuries also. Just to make things even more interesting when it comes to chronic shoulder pain, there are some rich supply of blood vessels, large ones that pass right by the shoulder. This diagram here shows arteries, but there's also veins and lymphatics that go down into the arm. And so trauma to this area can also cause injury to those structures. In all, there are 9 structures that can be injured in the shoulder. And you have to consider their injury when you have chronic shoulder pain. So in summary then of the anatomy and physiology, since you have structures that are juxtaposed so closely to each other, the likelihood is that your chronic shoulder pain has multiple mechanisms for the pain and not just one thing. And that results in needing multiple different therapies for your shoulder pain. Shoulder pain is not usually treated with just one therapy. overlapping mechanisms requires overlapping therapies. And so let's talk generally now about causes of chronic shoulder pain. One of the common causes is tendinitis, and there's a rich supply of tendons in the shoulder, and those tendons can become inflamed, and if they become inflamed, when there's any tension put on them, they hurt. When you move the shoulder yourself, it hurts more than when a examiner moves it, what's called passive motion. When you move the shoulder yourself, it's called active, and when someone else moves it, it's called passive. And in tendinitis, active motion hurts more than passive. Second cause of shoulder pain generally is a ligamentitis, and this is an inflammation of the ligaments. Ligaments attach bones to bones, tendons attach muscles to bones, and when ligaments are inflamed, active or passive motion of the shoulder joint hurts. Myofasciitis is where the muscle is inflamed. The fascia is the covering of the muscle, and like with tendons, when the shoulder is moved actively, it hurts more than when it's moved passively. And then there's arthritis, where the actual joint surfaces themselves are involved, and arthritis will hurt the same with passive or active motion. The most common cause of arthritis in the shoulder is degenerative. That's where the synovial cartilage gets pitted and worn down, and this is usually due to direct compressive trauma over time. As a fifth cause of general pain of the shoulder, you're going to have a bursitis. Now, the diagrams that I've included in the monograph did not show any bursa, but bursa are little pillows of lubricating tissue that keep the bony prominences from piercing through the skin, and also allow the soft tissues, ligaments, tendons, whatnot, to move quite nicely. And so a bursitis is also a source of pain, and when they're inflamed, active and passive motion hurt the same. You remember that the brachial plexus is close to the shoulder, and you can get a neuritis if you get nerve inflammation and swelling. And when they've been irritated, the particular type of pain that they cause is a burning type of pain, which is different from the other pains, which are more achy type of pains. And finally, there's a capsulitis, and a capsulitis is an inflammation of an envelope of tissue that surrounds the glenohumeral joint. It's almost like a saran wrap around the joint. So you can see that the causes of shoulder pain are very close to each other. I haven't even included some other causes. You could get a clot in a vein or an artery, or you can get an actual arterial or venous injury, which can cause pain too. But these are the most common causes of chronic shoulder pain. And because of their close proximity to each other, and because their physical examination does not really easily separate them, you usually have to have diagnostic studies of the shoulder in order to clearly identify what the cause of the pain is. There are three basic types of diagnostic studies. There's regular old shoulder x-rays, which will show bony abnormalities but won't show soft tissue, and that includes, they don't show the cartilage very well either. The MRI, which is the absolute best diagnostic study, it's non-invasive and painless, but it has limitations too, because there are some causes of chronic shoulder pain which only occur with a certain type of motion, a stretching motion for instance, and that will require additional diagnostic studies. And finally, there's arthroscopy of the shoulder, which is a surgical diagnostic study where a small scope is inserted into the joint cavity itself, and you can look around inside the shoulder. This, of course, is done by an orthopedic surgeon, but it has limitations too, because some of the causes of shoulder pain are not in the joint itself, and so they can be missed on arthroscopy. There are other diagnostic studies that can be performed on the shoulder, but we won't go through those now. These three, X-rays, MRI, and arthroscopy, are the three basic studies that should be done on chronic shoulder pain. Now, there are quite a few treatments for chronic shoulder pain. I've listed many of them. This is not a complete list, but what I have done is where I have written monographs on these particular forms of therapy, you can directly link from this monograph on how to treat chronic shoulder pain, you can directly link to the monographs and read them for yourself. I always recommend that people pray. Prayer is a very, very helpful treatment. You'd be surprised at how much pain reduction you can get. Of course, acupuncture, shoulder manipulation, either under anesthesia or while awake, by a chiropractor or by an orthopedic surgeon. They usually would be the ones that would do it under anesthesia. TENS therapy, cool laser therapy. I recommend that you look at my my treatment. Now, this is a laser that does not cut the skin or burn the skin, okay, but it activates the tissue and the biochemistry of the area deep in the tissues. Hot and cold packs, massage therapy, and of course water exercise, all very helpful for chronic shoulder pain. Continuing on down the page here, there's trigger point injections, and these are injections in small areas, maybe dime-sized or quarter-sized areas that are exquisitely tender. A general practitioner will often be trained in how to do this, and a small injection of local anesthesia and an anti-inflammatory agent is used. Of course, bioelectric therapy, this is very interesting. I recommend you read my monograph on this, where an electrical field is put through the joint. And then there's medicines, Motrin, Tylenol, Cymbalta, which is traditionally an antidepressant, but it also has pain-relieving properties. Lyrica, Australian Dream, you've probably heard this advertised as a cream. Of course, all narcotic medications can help with pain. Natural supplements and ultrasound therapy is also very good for chronic pain. There's also some therapies that are traditionally behavioral therapies, but they can affect chronic pain, and that's biofeedback and cognitive behavioral therapy. And then there's some natural therapies, supplementation, magnesium, turmeric, aromatherapy. These are all potentially helpful for chronic shoulder pain. I recommend you read my monographs on these. And then cervical traction, because sometimes pain in the shoulder is actually referred from the neck. Shoulder injections, I'll be writing a monograph on this soon. I used a 2-injection technique. It was quite effective. And then there's all the shoulder surgeries. What I want you to take home, though, from this treatment listing is that the treatments of chronic shoulder pain are usually multiple, and they have to be done over time. Each one of the treatments is directed at a particular mechanism or cause of the pain. And so when you have anatomy that's this close and compact, there's usually multi-mechanistic pain generation. So in conclusion, my final comments on chronic shoulder pain is that we've discussed the foibles of treating chronic shoulder pain, and that is that there are multiple overlapping anatomies which can get all hurt at the same time, and so you have multiple mechanisms of the generation of the pain. And I want to emphasize that as much of this therapy as you can do yourself, do it at home, or do it with, in a physical therapist's office. As much of this as you can do by yourself, the better. I found that most people do the best with their chronic shoulder pain when they take charge of the pain and they initiate these treatments and continue them on their own. Now, some of the treatments that we've offered and shown you, and some that will be offered to you, will not be able to be done at home. By the way, the listing that I've given you is not a complete 100% all treatments that are available, but it's about 90 or 95% of what's available out there. So you have a really good idea now, having watched this screencast, and if you read my monograph on chronicpainreliefoptions.com, you have a really good idea now of what's available to treat your shoulder pain. Of course, you need an accurate diagnosis, which usually means diagnostic studies. I hope you found this useful and helpful. If you have any questions or comments, please contact me by email on chronicpainreliefoptions.com. This is Dr. Jeffrey C. Beto. I thank you for spending some time with me today.